The Drug Policy Alliance was created to end the war on drugs and to build in its place a more sensible and effective approach. We envision a just society in which the use and regulation of drugs is grounded in science, compassion, health, and human rights, in which people are no longer punished for what they put into their own bodies, but only for crimes against others, and in which the fears, prejudices, and punitive prohibitions of today are no more. Our mission is to advance those policies and attitudes that best reduce the harms of both drug use and drug prohibition, and to promote the sovereignty of individuals over their minds and bodies. DPA's major objective is simply to reduce the role of criminalization and the criminal justice system in drug control policy while protecting public safety and health. Our first objective is reforming the criminal justice system. We want to see fewer people go into prison and jail for nonviolent drug offenses. We want to reduce the amount of time that people are spending behind bars, and we want to open up the variety of alternatives to incarceration. Our second objective is trying to deal with drugs much more as a health issue rather than a criminal justice issue. That means reducing the negative health consequences of drug use for those people who do get in trouble with drugs. It means trying to reduce the spread of HIV/AIDS through syringe exchange programs and better access to treatment. It means trying to reduce the number of people who are getting hurt or dying from drug overdoses. And it means making it a lot easier and more accessible for people to get into the drug treatment programs that are going to help them put their addictions behind them. Our third objective is basically to end marijuana prohibition in America, not unlike the way our forebears ended alcohol prohibition in this country decades ago. Over half of all drug arrests in this country are for marijuana possession. So what we're aiming to do is to reduce the number of people getting arrested for marijuana. What we've been doing is taking a leadership role in legalizing medical marijuana in a growing number of states around the country. And ultimately, what we're trying to do is to end the marijuana prohibition entirely in this country and to legalize, tax, control, and regulate marijuana more or less like alcohol is today. Our fourth objective is dealing with the challenge of young people and drugs in ways that are more honest, realistic, and effective. When people ask me, what do I say to young people around drugs? My first message is, don't do it. My second message is, don't do it. My third message is, but if you do drugs, there's some things I want you to know. Because my bottom line, as your parent who loves you to death, ultimately is not, did you or didn't you? My bottom line is, are you going to come home safely at the end of the night and grow up and make me healthy grandkids? The Drug Policy Alliance, we're the leading organization in the country and probably the world advocating for an end to the war on drugs. Nobody compares to us in terms of influence or track record of success. And really what sets us apart is our expertise in running robust, agile advocacy campaigns that effectively integrate a wide range of tactics. That's the reason why we've won dozens of legislative battles and ballot initiatives around the country over the years. Just as an example, we will pack activists by the hundreds into the State House for citizen lobbying days. We'll generate thousands of calls and faxes from our 200,000 online members. We'll urge major donors to the two political parties to make phone calls to elected leadership. We'll analyze and develop complex policy proposals and bills. We simplify our message and get the media to write and editorialize about it. We convince elected officials from both sides of the aisle to sponsor our bills. We persuade organizations from across the political spectrum to sign joint statements of support. Our legal team files amicus briefs on important court cases to prevent government overreach. And we don't stop till we win. And once we've won the legislative battle and turned something into a law, then we work with local and state officials to ensure effective implementation. One of the things that really distinguishes the work of the Drug Policy Alliance is the ways in which we integrate our incremental work, the work to which we devote the large majority of our resources, with our long-term vision of fundamentally transforming the way we deal with drugs in our society. Now, our strategy overall consists of three main elements. The first is advocating for legislative policy reform. The second is broader public education. And the third is building a sustainable political movement for drug policy reform. With respect to the first, where most of our resources go, it's on pursuing the incremental reforms at the local, state, and federal level where we can actually win victories over the next few years. In each case, we want our victory to achieve two objectives. The first is to benefit those people who have been or would be harmed by the laws that we're trying to change. The second part of our strategy is public education. It's about educating, teaching people about all the harms of the war on drugs and the ways in which it violates the values that they hold dear. Now, we're involved on talking to the media, writing editorials and op-ed pieces, working with journalists. I'll tell you something, in my organization of 50 people, over half my colleagues regularly deal with the media, and they are on message. This is about recruiting famous people who other people like to listen to, and it's about constructing the narratives of people being victimized by the war on drugs in ways that the broader public can understand. So we're shaping dialogues at the local level, the state level, the national, and even the international. We're orchestrating global commissions, and we're motivating former attorneys generals and police chiefs and others to speak out on our side. It's all about keeping this issue in the media, in the public's eye, in a way that helps them move to a new understanding. The third element of our strategy is building a sustainable political movement, one that thinks about this struggle not as something that you win over a few years, but that could take decades or even generations. We're one of the few national advocacy organizations that devotes a substantial portion of our budget to supporting dozens of smaller state-based or constituency-based or single-issue focused organizations around this country. We provide training and funding and mentoring and other technical assistance. We coordinate them on national campaigns directed at Congress. It's all about understanding that political change in America is not just happening nationally. It's about the work that you do in the local ground in your local communities. This includes providing funding, training, mentoring, and technical assistance to local and state-based organizations around the country. We understand that when it comes to politics, think global, act local. We're a national organization trying to move Congress, but also trying to move state legislatures and city councils at the same time. Evaluating the success or failure or efficiency of an advocacy organization is always a challenging enterprise. At DPA, we try very hard to be rigorous about this. Now, some of the outcomes are obvious. When we win a legislative battle and make a new law, that's a clear victory. When we win a battle in the courts, once again, that's a clear victory as well. But some of these battles take many years, and we have to develop other criteria to know whether we're moving forward. Did we move it through a committee? Did we recruit new sponsors? Did we generate the sort of media attention we hoped? It's also important to look at the outcome, the implementation. So oftentimes just winning a legislative battle or a court victory is not enough. We have to follow up and make sure that what we were intending to have happen actually did happen. Now, part of what we also do is have an internal process where every one of my senior colleagues prepares an annual work plan with a very tight budget. We're held to them. They get their quarterly budget reports to see how they're doing. So we're constantly providing feedback to our staff so that they can become more efficient. We integrate that work across the organization so that people are aware of what their colleagues are doing. So I would say as advocacy organizations go, DPA is at the cutting edge when it comes to rigorous metrics for evaluating our work. Something that most people might not know about the Drug Policy Alliance is the broad range of support that we enjoy. Our supporters come from across virtually every spectrum. We have people who are leaders in public health, but also criminal justice. We have progressives and conservatives and libertarians. We have academics and we have activists. We have religious leaders and we have people who are active drug users and people who are in recovery, people who have been behind bars and people who have enforced the drug laws, people who have lost family to drug overdoses and HIV, and people who have lost people to drug-related violence. I mean, there's no way to predict, really, who's going to support Drug Policy Alliance and our objectives. So take a look at our board, our honorary board, and you'll see that we include among our supporters some of the most distinguished and respected people in this country and indeed around the world. We've always been in the mainstream of the intellectual discourse around drug policy, but increasingly we've moved from the fringes of the political mainstream into the mainstream. That's the change that we're making happen today. DPA's played a pivotal role in reforming dozens of drug laws in cities and states around the country and at the federal level as well. As a direct result of our work, hundreds of thousands of people who would have gone to prison or jail did not do so or spent less time behind bars for a nonviolent drug offense. And tens, if not hundreds of thousands of people who would have been hurt by drugs or HIV/AIDS or what have you, instead are still living healthily and safely in our communities. Now, we're also getting our message out to the public and building a sustainable movement for drug policy reform. Our accomplishments in reforming criminal justice laws have really been striking. Back in 2000, we passed a ballot initiative in California, Proposition 36, to provide for treatment instead of incarceration. It was and probably still is the most significant, substantial reform of prison policy in America since the repeal of alcohol prohibition. Literally, hundreds of thousands of people who would have gone to jail or prison did not do so. Taxpayers have saved more than a couple $2 billion, and all sorts of new treatment programs were created and funded as well. More recently, in New York, we fought for almost a decade to overhaul the notorious Rockefeller drug laws. We won a couple of minor battles in 2004 and 2005, and in 2009, we won a major reform that's resulting already in thousands of fewer people being incarcerated. Now, when it comes to dealing with drug abuse more as a public health issue, there too we've made a major difference. I think most people know that using or injecting drugs does not cause HIV/AIDS, but sharing infected syringes does do that. We led the effort in New York, in New Jersey, California, and other states to implement needle exchange programs and to make sterile syringes more readily available in order to reduce the spread of this fatal disease. We've also now taken the lead with respect to the overdose crisis. Most people don't know that today, almost as many people are dying in America from an accidental drug overdose as are dying from an auto accident. Well, we led the way with Good Samaritan laws, laws that encourage somebody to call 911 right away if somebody they see around them overdoses. And those laws in New Mexico and New York, Washington State, and now we're trying elsewhere, once again, are saving hundreds, if not thousands of lives. When it comes to drug treatment, and especially for people who are addicted to heroin or to pharmaceutical opiates, expanding access to methadone or buprenorphine, that's the gold standard when it comes to reducing the death, disease, crime, and suffering associated with illegal drug addiction. We played a key role in making that more available to people who need it. And finally, when it comes to drug education, we're the ones, DPA, who partnered with the California PTA, the second biggest PTA in the world, to implement a sensible, pragmatic program for dealing with young people and drugs that teachers could embrace as well. And I'll tell you this, nobody has done more than the Drug Policy Alliance when it comes to changing public opinion and public policy regarding marijuana. You look at the 16 states that have legalized medical marijuana, we played a leadership role in almost 2/3 of that state. From the first battle in California in 1996 to winning the initiatives in Washington and Alaska and Oregon, Colorado, Nevada, and Maine, winning legislative battles to legalize medical marijuana in New Mexico and New Jersey, then going to the courts, in federal court, state court, and winning the pivotal legal battles to ensure that doctors and patients could discuss the medical benefits of marijuana without being prosecuted. When it comes to dealing with marijuana arrests, 800,000 people getting arrested each year in America for possession of a small bit of marijuana. We've led that effort in New York and elsewhere to change the way police do this. And finally, when you look at the dramatic transformation in public opinion regarding ending marijuana prohibition, just look at the Gallup poll each year, there's no question that nobody has played such a pivotal role in transforming public opinion as we have, through our advocacy, through our public education, and through the actual changes in laws that our work has occasioned. One part of our work I take particular pride and pleasure in is what we've done in terms of stimulating the debate around drug policy, not just in the United States, but really around the world. Some years ago, we organized a public letter to the Secretary General of the United Nations, and we recruited leading presidents, prime ministers, famous people from all around the world in a way that first sort of cracked this debate open. And more recently, we went back with a Latin American commission and a global commission with DPA playing a pivotal advisory role in this whole process. And we landed up working with the former presidents of Brazil, Colombia, and Mexico, and Switzerland, with former Nobel Prize winners, with Richard Branson, the well-known entrepreneur, and really to come out with documents that opened up and attracted media attention all around the world, even in parts of Africa and Asia, which have never before discussed this issue. So it's not just about the United States. People around the world say there's only so much we can do to change drug policy until America changes. That's why part of the reason we focus our work at home. But ultimately, it's about stirring up this discussion and informing debate worldwide. I think the most significant challenge we face is the extent to which the drug war mindset is embedded in ignorance, fear, prejudice, and profit. It's ignorance of the science about drugs. It's fear, every parent's desire to put their baby in a bubble and their fear about what drugs could do to penetrate that. It's the prejudice, the way in which so much of this war on drugs is really a war on people of color. And it's profit, from the private prison builders to the prison guards unions to all the others who make enormous money off of this. So all in all, you have to say that this war on drugs is deeply entrenched. It's codified in a complex web of policies in every state and locality, at the federal level, and even globally. The fact of the matter is this drug war has been around for a long time. That stuff can't simply be uprooted just by pulling quickly. It requires a sustained struggle. And finally, what we're also struggling against probably boils down to a lack of imagination. People want change. They know the war on drugs isn't working, but it's hard for them to envision change. Back when our forebears voted to repeal alcohol prohibition, they could remember just 15 years before to when alcohol was still legal, and they could see what it would look like in the future. But when it comes to something like ending marijuana prohibition, which has been around for 75, 80 years, people know it needs to change, but they're scared about what that will look like. Part of our job is holding their hands so that they can understand that the unknown of the future is still a safer bet than the problems of the present. I'll tell you, if we had additional resources, right now we work all around the country, but we have to focus our efforts in a small number of states because we just don't have the resources to do more. With more resources, we'd go from focusing on 5 or 10 states to focusing on 20 or 30 states. With those resources, we would begin to significantly reduce the number of people who are locked up, not just in New York or California, New Jersey, New Mexico, Colorado, states where we're deeply focused, but a whole range of other places. You know what else we do? We'd take our public education efforts to a whole nother level. We'd be able to engage in national media in ways that we've never been able to do. We'd have the resources to reach out to new constituencies. We still need to get the law enforcement community, the business community, a range of other communities in ways that have not yet been drawn into this struggle. With more resources, we would go from being an organization that is respected to one that is both respected and feared. That's about gaining power in American politics to do the right thing. What I wish is that we really had the resources to go head to head with the drug war establishment in this struggle. I mean, let's face it, we have the science, we have the evidence, we have common sense, we have the ethics, we have the health all on our side. But the other side's got the muscle, and they got the money, and they have the government tax dollars that they can spend as they see fit. I mean, just imagine if we had the resources to pay for the research that we know is out there, but which the government won't pay for. Imagine if we could pay for the lobbyists and for the legal expertise that the government can just buy without even asking any questions for. Imagine if we had the resources to run the sorts of public education ads that actually told the truth about drugs, rather than these anti-drug missives you see on TV, which even the government's own auditors and researchers say doesn't work. If we had the resources to really go head-to-head with the drug war establishment, this war on drugs would end and we would live in a more decent and compassionate society.